We'll get started if that's all right with everybody. May I have to just let people in as we go along, but I just wanted to start today off just by saying thank you for registering for today's webinar on ISO 45003. My name's Sheila Lord and I'm from BMW Health and Wellbeing. I just want to go through a couple of just housekeeping things before we get started. If you don't mind, can I ask that everybody keeps themselves on mute? We will be doing a kind of Q&A session at the end, so we can drop some questions in the chat, or you can kind of keep them until the end and we can open up the mic, everybody's microphones and have a chat then. And that's pretty much it. We'll go through questions at the end. The format of today is I'm going to give you the overview of the standard of the presentation, and then I'm going to show you one of the digital tools that we use to actually support adoption of ISO 45003. Okay, the session is being recorded, and following today's session, there will be a follow-up email that will give you links to the recording, plus links to some additional follow-up training from FlourishDx, okay? So that's the kind of housekeeping done, and we'll just get on with the session. So, as I said, my name's Sheila. I work at BMW Health and Wellbeing, and at BMO, we basically support organisations in adopting the very systemic and data-driven approach to workplace wellbeing, in line with 45003. And we do that working with our partners over in Australia. I don't know if a lot of you follow kind of a lot of the webinars that Flourish run and the live events that they run on psychological health and safety. But there's lots of fantastic free training and advice from them out in the world of LinkedIn. They also have a podcast, the Psych Health and Safety podcast, and at BMO we run a similar podcast emulating what they're doing over in Australia, but we're very much with a UK focused approach. And I run that podcast, the UK Psych Health and Safety podcast, with Peter Kelly from the UK HSE, and Peter was one of the contributing wellbeing mental health experts on the development of the ISO 45003 standard. Okay, so today's discussion points, we're going to look at a few things as we go through today. The standard is quite in-depth, there's quite a lot to cover, so we're only going to touch on some of the stuff that's in the standard today. So what I would suggest is that you do the follow-up training that just gives you a little bit more detail as you when you receive the follow-up from me. So there's lots of training available post this session today as well. Okay, so in terms of today's discussion points, what we're going to be looking at is the legislation, okay, and the size of the problem in the UK, because we've got a massive problem when it comes to well-being in the workplace and sick days that we experience in the UK as a result of work-related stress. We're going to look at an overview of the standard and then the importance of leadership. So we're going to touch on some of the specific clauses in relation to the standard as we go through. And I want to just really start with the basic UK health and safety legal framework. Okay, I see a lot of chat around LinkedIn and lots of other places calling for mental health first aid to be made as a legal requirement and pushing for that in workplaces. However, we have a lot of legislation that already covers our duty of care as an employer, okay, and protects our employees. So when we look at the health and safety legal framework, mental health or psychological health is covered under the Health and Safety at Work Act, okay? It's in basic legislation around UK health and safety. So the Act says in section 2 that as far as reasonably practicable, we have a duty of care to look after the health, the safety and the welfare of all of our employees. And that welfare bit, the health bit, as employers, we have a tendency to miss because we have a lack of understanding that this health and this welfare actually does extend to psychological health. Okay, so we do physical safety well, but we're not covering psychological safety. And there is case law dating back to 1995 that set the precedent around this. So it is absolutely clear in law that as an employer we have a legal duty of care. So the law says that what we have to do, we have this legal duty of care, and then the Management of Health and Safety at Work Regs 1999 in Regulations 3 and in Regulations 5 say how we need to execute that duty of care, if you will. And that is through carrying out risk assessments, carrying out information and carrying out training. It is no different to what we do for physical health. Okay, we just need to be doing it at a psychological level. And then you may ask yourself, well, how do we tackle that? Well, there is guidance out there. Okay, the guidance has been out there for a long time. The UK Health and Safety Executive Stress Management Standards were released back in 2004. So we've got lots of guidance documents out there. We've got, Thriving at Work. We've got Farmer Stevenson reports. We've got the Mental Health Commitment Checklist. We've got lots and lots of documents out there that help us to actually put these processes in place. But let's just focus on these two, which is number one, the UK HSE Stress Management Standards. And for those of you that are on the webinar today that are not UK based, you may or may not have something similar either in legislation in your own country or in similar guidance standards. However, as of the 8th of June last month, we've now at a global level got access to the 45,003 framework, which is, a real kind of granular detail and a framework of how we can embed psychological health and safety at work into our organisation. Okay, so we've got the legal framework that exists in law. Mental health at work is also covered under the Equality Act. And it's covered under the Protection from Harassment Act when it comes to bullying, and then there's more serious cases of harassment. We're looking at things like Corporate Homicide Act. So there is a lot of legislation that exists in the UK legal framework. Okay, so what I want to just do is to quickly just move on to the size of the problem in the UK, because it's a phenomenal number. Okay. In the UK, work-related stress, depression or anxiety, and this is work-related, we lost 17.9 million working days last year. Now, these figures were up to March 20. So these numbers are pre-COVID, and these numbers are the worst we have on record, okay? The stats from the year before were 12.8 million. So that's a massive increase, 5 million pre-COVID, and those numbers are increasing. I'm just going to say, sorry, is there still lots of echo on my, I'm just checking some of the notes in the chat. I apologise if there is. It seems to be for some and not for others. Okay. So the numbers around the working days lost are absolutely phenomenal, 17.9 million days. So, what we are doing in the UK is we've got these approaches that we're taking that are common approaches across the way that we're approaching many of the workplace mental health programs that we have in place, but they're not working. Yet we have been continuing to do the same things. So what am I talking about? Well, what I'm talking about are things like mental health first aid. Okay, mental health first aid has done a great job in raising awareness, getting people talking about mental health in the workplace, and that's fantastic. However, mental health first aid is there to triage people that are already struggling with a stress or work-related or mental health related illness. So we're already at the point of illness when we're looking at mental health first aid approaches, okay? The same goes for employee assistance programs. Now, I'm not saying there's anything wrong with having these as part of your wellbeing program. They're actually a very key piece of having these in place for your mental workplace wellbeing strategies, but on their own, they're not enough. And the numbers evidence that, yeah? The numbers are the worst they've ever been. Yet we've got more and more mental health first aiders trained in the workplace. On its own, it simply isn't enough. We've also got things like exercise classes, we have nutrition workshops, we have fruit bowls, meditation, yoga. All of these are really fantastic initiatives. However, they're very person-centered, they are focused on injury management, and they're all less effective, okay? It's evidenced in the numbers, and yet we continue to do the same thing, yet we expect a different result. And if you look at these current approaches and look at what I was just saying a second ago about the legal requirements around the health and safety legislation, none of this is a legal requirement, okay? The legal requirement piece that we're missing, and the piece that's missing from all of these approaches, is the risk assessment, okay? And that's the thing that isn't being carried out. So if we truly want to look at an integrated model of workplace mental health, we've got to recognise that mental health exists on a continuum. So for those of you who've done mental health first aid training, you'll recognise that. However, you know, with the current approaches that we've got, if you look at the mental health continuum, we will have people that are on a different elements, different stages of this continuum. So you will have people that are in optimal well-being, that are flourishing, that are really on their game from a mental health perspective. We'll then have people that exist in an area of mental wellness, and that will be a lot of us. And then from time to time, through life events and things occurring, bereavement, you know, pressures at work, pressures in the home life, we may slip into this languishing, and then we've got mental disorder. So if you look at that bell curve there, and then you look at the different approaches that we've got, when we're looking at this integrated approach of primary, secondary and tertiary interventions, a lot of what we do is focused on the tertiary, which is mitigating illness. And I always put this into the same context as physical safety. You know, we wouldn't remove a safety, we wouldn't not have a safety guard on a piece of equipment on a shop floor. We wouldn't remove a stair banister. It's there to stop people falling. Where do we put measures in place in the workplace to stop people falling? Yes, we've got fitness classes. Yes, we've got some of the health promotion stuff. But what are we doing around identifying the factors in the work design and in the workplace that are contributing to people's stress levels, and working on doing what we can to reduce those factors? So, you know, if we want to promote flourishing in a work environment, one of the things that we first need to be doing is to look in at identifying what those risk factors are, and looking to eliminate or reduce or prevent those factors from occurring, okay? So we need to put these organisational controls in at a primary level to limit or prevent this exposure. Then, if we can't limit or prevent this exposure, we then need to look at how we can help workers to cope with the exposure to those risk factors. And then worst case scenario, we've got, you know, the equivalent of a physical first aider, where we're mitigating illness and we're looking at injury management. So, you know, when we're looking at this integrated model of workplace mental health, the primary focus needs to be on actively preventing harm to promote psychological well-being at work. And this is fantastic now, because we've got the 45,003 standard that's coming, and that's looking at the psychological health and safety at work, okay, in respect of managing psychosocial risks, okay? Now, for those of you that are not familiar with the standard, you can actually get a free copy from the ISO website. There will be a link to that in the follow-up email from today's session. Now, the ISO standard, it's been developed by the leading practitioners on a global basis, okay, across 74 different countries over the last 3 years, okay, last 3 to 4 years. So, you know, there's some of the best minds in workplace health have come together to agree the best practice on a global basis for this standard. So it's a solid framework, okay? It's been specifically done, for those of you that may or may not be familiar with ISO 45001, it's been specifically put under as a child standard under 45001. And that is because, and that's been done deliberately, workplace wellbeing has always or traditionally been seen as a HR responsibility. And with the 45003 standard, it was specifically put under the Occupational Health ISO as a child standard, because we're trying to shift psychological health and safety into the health and safety arena. So it becomes part and parcel of an organization's safety management system. And it's done in conjunction with HR, but using the skills of risk management that health and safety professionals can bring to the table, okay? Now, it's a voluntary standard, and as I say, it's a child standard along 45001. And if we do 45003 well, and don't just pay lip service to it, it can be a real game changer, okay? And why do I say that? Well, if you look back at the figures around sickness absence, when the HSE first brought in the stress management standards, which focused on workplace factors rather than individuals, okay, there was a significant reduction in absence statistics relating to mental health. And it's only in the last kind of 8 years or so that, you know, the focus for workplace mental health has slipped back onto the individual and going back to the kind of the 90s approach of teaching people how to cope, and that's clearly not working. So we know that if we go at it from an organizational perspective, that we will see a reduction in the numbers, okay? So what we need to do in terms of the scope of the standard, if we relate this back to the slide I showed you earlier on the integrated model of workplace mental health, it's the scope of the standard is to prevent work-related injury, to promote well-being at work, and then do this within an occupational health and safety management system. Now, 45003 isn't designed to replace current initiatives, but it's there to support, complement, and bring it all together, okay? And most importantly, what it's doing is it's bringing into play the risk assessment piece, which is missing, okay, across many of the programs that I've said. So when we're looking at it, for those of you who are not familiar, you know, what is psychosocial risk? You know, there's lots of new words that we're seeing kind of bandied around on LinkedIn and in different contexts when it comes to workplace wellbeing. And psychosocial basically is anything in our environment that we respond to in a psychological or emotional way. So we put that into the workplace context, yeah? These are anything in the design of work, so be it workload, be the level of control that we have, our social factors at work, all of these different things will contribute to how we respond on an individual basis emotionally in our day-to-day activities at work, okay? So that's what it is. It's how we're responding to our work environment, okay? So that's what we've got with psychosocial risk. And then the well-being at work is basically our fulfillment of our needs and expectations related to our work, okay? So what we're doing is making sure that we've basically got a happy, productive workforce, culture, work environment, okay? And 45003 is all based around risk management principles and this plan, do, check, act cycle. And the plan phase contains the majority of the requirements in the standard, okay? And clauses 4 to 7 are basically focused in the standard on what do we want to achieve and how are we going to do it, okay? When we then look further into it. We're then looking at the implementation part in the do phase, looking and checking at whether things went as planned in the check phase. And then in terms of acting, we're kind of closing the gaps and we're continuing to improve, and we'll go again. And I'll come back to this bit where it's focused on continuous improvement. It's focused on embedding this through your health and safety processes as a systemic part of what you're doing within your business. Okay, so we don't just do it and stop, or we've done that, we've ticked the box and we've moved on. This is a systemic part of what we're doing in our organizations on a regular basis. Our work environments change rapidly, technology changes rapidly. We've seen with the pandemic how, you know, these macro events can throw great big curveballs at work life and at home life. So risk assessing psychological impact is absolutely key. And as our society moves at a much faster pace, you know, that gone are the days where an annual engagement survey will be enough. And it's, you know, and I'll come on to that in a little bit later, but we need to have this as a continual part of your business process. And this is where we look to kind of support you, so you can do that easily, cost effectively, and embedded into part of your organisation. Okay, I just need to take a drink of water. Okay. And this is one of these things, just touching on this continuous improvement piece, you know, what we're looking to do is identify kind of the main areas that we need to focus on, and we identify those an area at a time. We fix and we work on the low-hanging fruit, the areas of the, you know, the biggest areas of concern. And then once we've worked on that, as we will do with any risk assessment or business improvement process, we work on that piece, we go back, we checked it works, and then we go again. It's going on continually and continually, because this never stops. Okay, so it's not a case of we train a mental health first aider, we put an EAP system, we tick the box and we walk off. If we want to do this well, if you want to get a return on your investment, if you want to create that great organization, then you need to do it properly. And to do that, it requires one major thing to get us started, okay, and that is leadership commitment. Okay, what we're talking about here is change management. Okay, and like any change management process, it really needs high level commitment. So coming out as the MD or the leader in the business and saying, yes, we're going to do this, and just putting your name to it isn't enough. Okay, talking the talk is not enough. Okay, we need to be able to have from leadership, you know, the budget. We need to be able to identify the resources. You know, we can't just go to people that are already stressed, that already have a lot of workload on their plate. Oh, we just want you to do this. We just want to throw some more in on top of what you're already doing. No, you can't do that. You need to be looking at identifying the resources, identifying the people, identifying the budgets that are required to be able to do this well, because we need to resource for it. We're going to do this as part of a systemic approach in our business. It needs to be a whole organisation, so it needs to be embedded into our policy, into our procedures. It needs to be knitted into the fabric of our businesses kind of ethics and policies. So we need to have that in as part of our assessments, as part of our resources, our training, our policies, and it needs to be incorporated into your regular health and safety policies. Some people prefer to have it as a separate mental health policy, but why differentiate it? We talk about stigma, we talk about breaking down discrimination. You know, this is just another facet of health and safety. So we need to look at integrating this into policy, and then looking at who is going to lead this. Who are the organisational roles in this? We don't want somebody that's not going to be interested in doing this. We need people to lead it, you know, and train your people appropriately. So we need to look at these organisational roles, the responsibilities and the authorities within the business. And that's great. And we can have all of that. And this is where I feel there's an issue with when we come on to the next bit. And we talk about consultation and participation of workers in the standard. Okay, so some of you may work in a business that does annual engagement surveys, and a lot of the time these annual engagement surveys go out, and we they come back and we identify this design of work, and we look at, oh, we've got high workloads, oh, we've got low levels of control. And quite often, there's not always timely feedback to employees. And quite often, there isn't always consultation and participation, consultation with workers who've participated in the survey to get feedback. Okay, often from the engagement surveys, leadership, management, HR, whoever's responsible for those surveys will often go and make decisions or implement procedures, processes, wellbeing improvement plans based on what they think they know, rather than consulting with the people that have given you the information. And the other thing with the engagement survey, it shows us the design of work. So it might show that we've got high workloads and low demands, okay? But as a person that's reviewing that survey, what we're looking at is, when we're looking at high workloads and low levels of control, we're assuming that that's having an impact on somebody's well-being, but we haven't asked them, is that an impact on your well-being? We've asked them about the design of work, okay? So for John that's coming into the office, he might love to walk in at 9 o'clock every day, get his head down, work through his high workloads, because he thrives on having a high workload. He doesn't want any high levels of autonomy. He just wants to get on with the job and do it. And then he goes home and he's happy. Yet for somebody in another department that's in a job role that's got high workloads and low levels of control, there might be frustration that there's too much to do, not enough time to do it, and I don't have the authority to be able to do it in a more effective and a more efficient way. So we can't just look at a factor and assume that it has one impact on one individual, on a group of individuals. We need to understand how that's impacting individuals equal, you know, on how it's influencing people on an individual basis. We can't make those assumptions. And then once we've got this information, we need to consult with our workers. Without these elements that are covered in clause 5 of the standard, you'll really struggle to implement anything like this well, because you wouldn't have the commitment from the leadership at the top. It's not going to go anywhere, because you're not going to get budgets, you're not going to get the resources. And then if you don't consult with and participate with your workers, you're not going to get engagement. You're just going to have a disengaged, disempowered workforce. It's got to be done as this collaborative approach, where we listen and we empower. The workers understand what it is in the design of work that's causing them stress, if that's the case, and they'll also often know what the solution is. And it will all come back to resource, budget, people, etc., etc. Okay. So what I want to do is to now talk to you about a tool that we've got, or a feature that we've got, sorry, in the FlourishDx platform. And this is a feature called the Flourish Factor. And what I'm going to do is I'm going to come off the slide deck in a minute. I just want to talk to you about this first. But this is a feature that helps to kind of unpack the standard, implement the standard, and then measure your performance and the performance of your wellbeing management system against that standard. I'm just going to stop the share there for a minute while I switch screens over. And while I'm doing that, if anyone wants to have a quick chat, I'm just going to get this switched over. I'm hoping it will go quickly today. My internet stands up.
I think it's interesting when we talk about health and safety in its old format of physical health and safety. Mm-hmm. We're all drilled in to whatever organisation we work for. Who's responsible for health and safety? And the answer is not the health and safety manager. It's not HR. It's everyone. Everyone is responsible for health and safety. And I'm wondering what your thoughts are on the mental health and safety of the workforce. Are we all responsible for our colleagues and for ourselves? And will ISO 45003 and the training that goes with it make it easier for me to walk into the office and say to my line manager, I'm feeling really stressed by the workload that I'm doing at the moment. and I need your help with this.
I would hope so. I would hope that that's where that eventually leads to. You know, it's all about creating psychological safety, isn't it, Dave, in the organisation? And that psychological safety is about people being able to speak up and say how they're feeling without fear of recrimination.
Yes, absolutely. Yeah.
So yeah, creating this psychological safety piece, I think, is absolutely critical. Can everyone see my screen? I'm assuming you can. Yeah, brilliant, excellent, thank you. Okay, so this is the FlourishDx platform, and this is a psychological health and wellbeing safety management system, okay? And it's been very much designed alongside 45003. And I just mentioned before about the Flourish Factor. Now, the Flourish Factor dashboard, this looks at the standard, okay, of 45003, and what the standard is what we've done with the standard here, or what the guys over at FlourishDx have done, is they've unpacked the standard into 23 different requirements, breaking down each element of the standard, and each one has an action step within here to help with adoption of the standard. And what we do, as we match off against each action step, we score points in terms of measuring the maturity of our health and safety management system. So each page, so if we take page 5 here, Consultation and Participation of Workers, each page has a top level overview of what that is. We have a small training video within each element, a short video description of the requirements of the standard in this particular instance. And then there's a set of recommended actions. And you can see down here that we also have, we show here the elements that are addressed as part of the ISO standard. Now, the platform is designed to be as integrated as possible and provide as many tools as possible when it comes to being able to kind of execute this all in one place. And there's never no one product or one size fits all. This, as I said before, this is here to complement and support what you've already got in place. So, for example, one of the things I touched on before was the fact that, we need to be able to provide resources. And one of the resources that we would need to do in terms of 45003 is to train and educate people, okay, in terms of psychological health and safety, and what that is, and why we're doing it, and why it's important, and what an employee's responsibility is around psychological health and safety. So wherever we can, we've built tools into the platform to help to support that. So in this particular instance, so we're getting to the part where we need to have workers have the opportunity to provide feedback. Have we provided training in psychosocial hazard identification to workers? Because hello, do they know what that is? So we need to be able, we can't make assumptions that, oh, hi, we don't do psychological health and safety, and by the way, can you start to fill out these survey tools? It's not going to work. Okay, we need to create that culture. We need to create that training, that education piece before we start in all of this. So, we can, one of the steps, and these steps are done in sequence. So let's look at step 5 here. So, is to create a mental health e-learning program. So we can create a mental health e-learning program. And then we've got a number of different videos and learning programs in here, all short animated video. If you watch them all at once, take you an hour and a half, but we've got some essential videos in here that really should be looked at by members of staff, and maybe mandated again when you're looking and defining your policies. But as a minimum, people can't join your organization and go, oh, I'm not going to do any of the physical health and safety videos or training or the manual handling. I'm just going to swerve that. It's not allowed. So why would we allow that to be the case when it comes to psychological health? So, we've got psychological health and safety for employees, so we can select that. And what are the responsibilities? As a basic, we need to be doing that. So we can create these programs very quickly and send them out and get them, get the employees educated. So we've got tools in there that help to support that. So, it takes us through each of these steps. And then when we're looking at things the next step, once we've educated people, is to really then get into understanding what's going on in the organisation from a psychological health and safety perspective. And this is something that needs to be done on a regular basis. So we've got, again, tools built into the platform that we've developed all the time. And one of those tools is a really simple wellbeing check-in request. Okay, it takes 30 minutes for an individual, not 30 minutes, it takes 30 seconds for an individual to conduct that step. Okay, so we can request a wellbeing check-in to people in the organisation, and what that wellbeing check-in does is it quickly asks, let me just show you, the individual to tell us how they are feeling. Everything in the platform, by the way, is anonymised. As an employer, you see this at a de-identified aggregate level, which we can break down into work groups, but only if there's a minimum of 8 responses. So when we send in a check-in request, the employee will be asked to check in, to use a sliding scale here of how they're feeling, and to give, we're going to be very content today as to why they're feeling that way. So, and then we split this into workplace factors and individual factors. Okay, what that allows us to see in the background from a check-in perspective, as the employees check in and all of that, the dashboards in the platform are live, is that we can then start to see the reasons, so how people are feeling, and it tracks it over time. But then what we can actually look at, what are the individual factors that are contributing to a person's well-being, either positively or negatively, yeah, and what are the workplace factors that are contributing to an individual's well-being, either positively or negatively. Okay, and we can break that down further by user groups. Okay, all of this is customized to your organization, so whether you want to look at that by location, by department, by job role, by night shift, by day shifts, and we can then have a look at and really get into detail as to what are the factors that are impacting people positively or negatively. And what that allows us to do is to really make more informed decisions on some of the health promotion activities, some of the work design stuff that we do, and the needs for where we need to focus and what we need to do. So it gives us that very top level kind of pulse view, and we can do this. So we can, with the problem with engagement surveys is they're done generally annually, so you're not getting enough momentum, you're not constantly understanding what's going on. The world's changing. Engagement, this type of feedback we need more than once a year. So this, carried out monthly, allows us to keep a check on what's going on along here, and then really get into the individual and the workplace factors here. So that's one of the tools that we've got, which allows us to keep a temperature check on the organisation on a monthly basis in a 30-second click of a button. Okay, further tools to that. So we've got the we've got that in here in terms of a wellbeing check-in, but then, when we want to take that a bit further, we then want to kind of looking at assessing the risks and the potential opportunities that are associated with those factors. So the way in which we can do that is to create a risk assessment survey. And again, one of the things I get often is that, oh, well, we don't need to do a risk assessment survey. We've already got that covered in an engagement survey. You haven't. You really haven't, because as I said before, the engagement survey looks at the work design factors. It doesn't look at the impact on an individual. So we've got the options here to create our risk assessment surveys. And what we do within the surveys is we look at the organisation, and then we look at customising the survey. And you'll see at the top here, engagement surveys can sometimes be quite lengthy. What we try to do, well, what we have done here with these risk assessment tools is we've made them short and snappy, so they're not cumbersome, so they can be done quickly. And actually, we can put out a risk assessment survey request in the morning. We can have it completed by lunchtime. We can be running a workshop on it in the afternoon. Okay, one of the other problems I hear about employee engagement surveys or survey fatigue. Okay, people get fatigued by surveys because they fill them in and get no feedback, and they think, what is the point? Okay, with this we can request it in the morning, have the feedback in an hour, 2 hours, because the dashboards are live. We can have the workshop in the afternoon. We can start to have those conversations, and it looks at these different workplace factors. Well, and the recommended ones are the ones that you'll find in the HSE stress management standards. So these are the kind of key psychosocial risk factors or potential hazards that exist in the workplace. We then look at other popular ones which we can add in. So some very relevant stuff here would be remote work, isolated work with COVID and this new hybrid working. And again, because this is on a digital based, desktop or mobile based access, we can reach people all at the same time, okay, and get those responses. Now, where this differs from an engagement survey is that an engagement survey just asks about the impact at the workplace factor, okay. However, if I'm looking at this particular one, I'm just trying to get to the beginning and go again. So we're looking at work overload. So we're saying to the employee, when the demands of your job are greater than your capacity to meet them, how is that impacting you? Does it have an impact on your well-being, leaving you either feeling stressed, overwhelmed, angry, upset? Because people experience impacts on their well-being in different ways. So we use a sliding scale here, okay, as an individual response to tell to you, as an employer, has either next to no impact on me, no impact at all. If it has no impact, I move on, okay? So having low job control, does this impact me? Having little ability to influence what happens in my work, little or no control over work tasks, etc. If that then does have a well-being impact, okay, then I need to know as an employer, how often is that impacting you? Is it once a year or less, or is it daily? Yeah, and how long is that lasting for, that impact? Yeah, up to an hour, up to a week. Is it constant? Okay, at this point now, we're not just identifying the factor in the workplace, but we're looking at the frequency and the duration. And I always use an example of a noisy factory. So if we've got a noisy factory and we're a health and safety person and we're looking at assessing the noise, we don't just go, oh, we have a noisy factory because we have noisy machinery, therefore everybody in the organisation is exposed to noise, therefore you all need ear defenders. Well, actually, I don't. I'm working in the office. Or actually, I'm working in a different part of the factory that doesn't have that machinery that's creating that noise. So what we need to look at is everybody's roles and everybody's departments are very different. So if you put it into the noise context, what impacts the person that stood next to the machinery is very different to what impacts the person up in the office. And so we can't just look at noise and apply one solution for everybody. We have to look at the impact on the individual. And you're not going to know that impact on the individual unless the individual is telling you. Okay, so we do this in a way that is looking at those three different factors, okay? Really important, so that when we're looking at the results of those surveys, okay, we are then actually starting to understand the severity, the frequency and duration of a risk, okay? And then we can start to get to work on what the solutions are around those risks. So if we look at this one here, you'll see that each of these have a circle. So the red circle is severity, the orange circle is amber circle is the frequency, and the duration is the blue circle. And then we calculate this as a total risk factor. Okay, so we carry out our risk assessment and we can see here that workplace incivility as an overall factor, scores the highest. However, that's an organizational approach. Like taking the noise example, that noise one, if this was a physical safety one, could be low, it might be further down. So if we then filter it by department, that might change when you're looking at it at a work group. So now, workplace incivility has actually disappeared as a risk factor for London. Okay, so we've got a different focus here. So again, going back to this, one size does not fit all. We need to understand what's going in each one. So when we talk to London, oh, you've got a poor work-life balance, but New York might have a great work-life balance. So, you know, what are the learnings that we can have there? What are the conversations that we can have? What is it that's going on? And actually, once we open up the floor to then review and consult with our workers and empower them to come up with the solutions to some of these areas that are getting flagged, we actually then start to be able to put in place well-being improvement plans. And then what we do is we put the action plans in place. Okay, so again, pulling together a very simple mental well-being management plan. We do as we would for any improvement plan that we would do in our business, and we would look at, you know, what are the actions that we are looking to take. So we look in this particular instance, you know, we've looked at a specific department, we've identified the risk factors. These are the agreements with these are the actions we've identified in consultation with workers. We've allocated a responsible person, we've allocated an action date and a review date. Okay, and because we go again once the actions have been completed and we resurvey the staff. It's a 10-minute survey. And then what we can do from that survey is that we can then compare survey 1 to survey 2. Okay, so we can look at the selected survey and a comparison survey, and we can work through that and see whether or not we've had the desired effect in terms of has it gone up or has it gone down. Okay, so these are the tools that we've got in there, and then doing the risk assessment in this way removes any level of assumption. It's quick, it's effective, and it allows us to measure the impact of what we're doing, okay, and the effectiveness of the control measures that we have put in place. It also allows us to track, and we're building up all the time in terms of the dashboards. It allows us to track specific outcomes, so we can look at intention to quit. So we can start to get some cultural kind of, I think of these as cultural KPIs. You know, what is the intention to quit among people in the workforce? What are the barriers to accessing EAP? Do we have them? And if we do, what are the reasons for that? Focuses on areas that we need to hone in on. So it gives us data. It gives us a lot of data to work with that allows us to make the right choices with a whole organisation approach, in consultation with Occ Health, in consultation with HR, in consultation with leadership, management teams, employees. It's a whole organisation approach because everybody works in that organisation. Everybody is part of that culture. Okay. And as I say, we've got the line employee learning, we've got line manager learning. So there's a lot in there. But, you know, the Flourish Factor is this really breaks down the ISO standard for you and helps you to kind of get that framework in place. And that's whether you're going for accreditation or not. You know, 3 years in the making, some of the best global best experts globally in mental health, they've put together a framework. Why would we not look to use this? Yeah, there are lots of awards out there. We can go to different best company awards to work for, etc., etc. This brings all of that together, okay, in a systemic and measurable way. Okay, so that's me done. I'm going to take another glass of water because I'm dying of thirst, and I am going to stop sharing my screen. Have I stopped sharing my screen? Okay. Okay, does anybody have any questions? No? Okay, excellent. Well, as I said before, you'll get free link, the link to the free standard in the follow-up email. You'll get a copy of the recording and you will And that's it. Recording, the training, and a copy of the standard. We've got 2 trainings out at the moment. One is the ISO 45003 foundations course. The other one is psychosocial risk assessment. And coming out this month, there will be another training video on how to make the business case to leaders. Steve, do you have a question?
Yeah, it's more a request, actually. I'd love to set up a call with you afterwards, if that's okay.
Yeah.
I set up an organisation earlier in the year called Men Able, and we're on a mission to take this kind of stuff out to the automotive industry globally.
Fantastic.
And as you might imagine, the automotive industry, apart from being male dominated, has some fairly archaic attitudes and behaviours at times.
Of course.
But what we found is we've got an immediate amount of traction globally across 5 countries from people who are interested. So yeah, if you've got some time, I'd love to have a chat with you.
Sure. No, that's absolutely fine, Steve. I just popped you a message in the chat box.
Perfect. Thank you.
Yeah. Anybody else? Any questions? And you're right, Doreen. Everybody's in this together in terms of the the approach to this. It has to be a combined organisational approach. Okay, so I want to say thank you guys, and I'm going to hop off the call now, and I really appreciate your time this